Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well, and welcome back to another very nice case. This is another case of sort of a dead skin on the eardrum, false eardrum, neotympanum, shrink wrap eardrum, whatever you want to call it. It doesn't have an official name, but it is a layer of dead skin which has grown on top of the patient's eardrum, as you can see, which is causing quite a considerable hearing loss. This is really distressing the patient. And the reason that I wanted to upload this one is because this is probably the worst one that I've ever seen. So if you go back onto the channel and you just look at various eardrum videos that I've made, just some sodium bicarb here, which is what's pooling in the ear canal. Previous ones that I've showcased are, relatively thin layers. They come off quite easily. It's all fine. This is actually a very thick layer of dead skin that's formed on the eardrum. So it's all, it's quite leathery. And I'm just trying to catch this bottom lip here. Now with the sodium bicarb in the ear, the hearing is obviously much worse, but it's the only way. So you can actually see that now some of that sodium bicarb has actually kind of slipped underneath this dead skin layer. And you can just see the eardrum starting to appear. So the eardrum should be that kind of nice classic greyish blue colour, which we will reveal in a moment. But that bicarb has moved up through the dead skin layer and gotten in between the drum and the layer, which is what I want. But it is still very stuck in places. So we're just going to have to take our time with this. I'm sure many of you are wondering, how has this happened? I'm not entirely sure. I'm seeing more and more of these cases of late. It's really weird. It could just be coincidence, or it could just be that I'm better at spotting them and dealing with them rather than referring to ENT. But I would assume probably that this patient had an infection at some point. To be honest, I can't remember the patient history. This is a case from a few months ago. But usually when you see dead skin layers like this, it tends to happen when the ear has been infected. And then the skin, what you get is rapid cell turnover. So the skin starts to divide, that basal layer of the skin starts to divide very rapidly in response to infection and chemicals that are released from white blood cells and so on and so forth. So you get this rapid replication of skin, and that leads to a rapid shedding of skin. And then that, combined with various drops or medicated drops that the patient's put in the ear, may have formed this sort of crusty layer, dead skin sheath, I suppose, on the drum. That's just one theory. So again, struggling here a little bit. And again, in previous videos, you will have seen, quite successful and quick kind of jump off the drum it comes. It's usually much easier than this. But again, this kind of bottom layer here is quite difficult. And I'm just going to try again. This is ultimately going to need some more bicarb. More sodium. See, I'm just making some progress there, but it's just not enough. Which again shows that although I've applied one round of bicarb, again this skin is very dry and thick, just coming off the drum there. And incidentally, patients finding this very comfortable. You can actually see where it's attached right there. I don't know if you can see. So you can see the drum flexing a little bit just to that little segment, which shows that bit's still attached. So just pulling on the drum a little bit, which is really to be avoided. We don't want to do any more than just gentle flexion. But patients finding this very comfortable. Again, the feeling that she's getting is just a very gentle tugging, not hurting. And again, she can hear, if the eardrum was totally exposed and nice and clean, she would find the sound of the suction extremely loud and comfortably loud. But again, this is, there's still a hearing loss there. So she's finding the noise level quite comfortable. Again, just pulling very gently here. And again, we can see the drum starting to flex. And we're going to need some more bicarb here. So I've just applied some more. Obviously, this is going to inevitably smear up the endoscope, which it always does. Or maybe not, actually. Yeah, there we go. See, it's just an inevitability, which is really annoying. because then you have to exit out of the patient's ear and then wipe the endoscope off. But I haven't really found a solution to that yet. So, right, so now we should have a bit more success with this peel. Bicarb's gone in, moistened everything up, moved through the layer of dead skin, soaked into it, and now we should see a good degree of success. You can just see the eardrum underneath that bluish purpley loveliness, and there's going to be a little bit of it's going to look, the drum itself is going to look a little bit what we call erythematic, or which is just a medical term for redness. But again, we've been working down there, applying bicarb and peeling the dead skin off. So although it's not been hurting, you will see a little tiny bit of inflammation, but nothing to worry about. But that's erythema, or I think it is derived from Greek for erythros, which means red. So there we go, lovely looking eardrum, and there was the eardrum peel. So there we go. I hope you found that video interesting. If you have any questions or comments, leave them down in the comment section below, and I will try my very best to get back to you. And of course, I will see you guys on the next video.